Good evening, ladies and gentlemen. I hope you're doing well. It's a weekend. I hope you enjoyed and rejuvenated well. That's fine. So, for those of you who've been following up, I introduced a topic, medication ABCs, which was basically to empower you as a user of medicines on all aspects surrounding your medicine use and their correct usage. So, we've been doing a series of talks on the YouTube channel. I hope you subscribed already, and there are more and more in store. So, today we want to talk about another topic, medication errors. Medication errors is a very interesting topic because it touches on healthcare facilities and also community based pharmacies outside there. So, you know that medicines form part of the major healthcare system, and correct usage, correct management, correct storage, and also correct prescription and dispensing of medicines lead to a better outcome of those medicines to the patient. And the outcome is always the well-being or the curative part of the medicines on the patient, which in any way, by all aspects, is the joy of every healthcare worker. So medication errors, basically, today we are going to look at several aspects of medication errors. We are going to define medication errors, factors surrounding medication errors, contributing factors, that is. We're also going to look at the impact of medication errors in a healthcare facility or a community-based pharmacy. We also want to look at what are the causes of medication errors. Then finally, we are going to give you solutions of preventing medication errors from occurring. So quick one. Definition. Medication errors definitely is an event, and this event is preventable. A preventable event that can lead to harm or has a potential of causing harm to the user, or can lead to incorrect use of medicines while those medicines are under care of a healthcare giver or the user, which in this case is the patient. So other aspects contributing to medication error that we're going to talk about today are like near misses, sentinel events, adverse effects. We are going also to look at sound-alike medicines and look-alike medicines. Then we are going to touch on high alert medications. In one way or the other, these aspects has one or two contributing factors into medication errors. So what are some of the consequences of impact of a medication error in a healthcare facility? Number one, it can lead to death. You know that very well. We've seen several facilities where incorrect surgeries we've seen in medicines given to the wrong patients has led to fatalities. It can lead to loss of functions, that is physical functions, injuries. It can also lead to hospitalization, and it can also lead to birth defects. There's some medicines that are contraindicated in certain ages or in a certain population. So all those, when used in error, can lead to the consequences we just talked about. So what is a near miss? Because these are some of the aspects that can lead to medication errors. So a near miss is an unpredictable event that had a potential of causing harm or injury to a patient, but was intercepted by the healthcare worker, the patient themselves, or the family before it reached the stage where it could cause harm. Let's say, for example, you dispense a medicine. Let's talk of digoxin. As you know, digoxin has a very low therapeutic, has a very narrow therapeutic index. That means the risk is very high when used in error. So you dispense it to the wrong patient. Maybe the patient only had a flu. Then due to confusion in the naming, you've called a patient with one single name instead of two names, maybe James, for example, and there were two Jameses on the line. So one of the James that was not supposed to receive the digoxin stands up and receives the medicine. So in the process of maybe inquiring more, what is your second name? They tell you, I'm James XX. And then your curiosity directs you, you use a registration number to check and key in the system, and then you realize that there are two James on the line. Then you now use the number or the two names now to identify the correct James, and then you withdraw the medicine before the other James go home and start taking the medicine. That is a near miss. If you could not have acted fast, it could have led to something else. There's also something called a sentinel event. A sentinel event is an event which leads to death or can cause physical or psychological injuries that are not related to the natural causes of illness of a patient. Let's say, for example, in a theater, you do a procedure, surgical procedure, on the wrong patient. We've seen it in several facilities in Kenya, reports here and there. You leave an object on an incised or a surgical area or surgical site of a patient. That's a sentinel event. Yes. There are rape cases that do occur in several facilities, in acute centers. Yeah. All those events are called sentinel events, and in one way or the other, they have been caused by a medication error or an identification error, something like that. There's look-alike medicines. These are medicines that have almost the same appearance. They might not necessarily be from the same company, but by coincidence, they appear the same. So what happens is some facilities that you store them differently in different compartments, and then there are always stickers or labels where you label there look alike medicine, so that it can alert anybody, even if they didn't know, that this and this medicine will look alike and can cause confusion, hence leading to medication error. Sound alike medicines. These are medicines that basically sounds alike. So if you are being given an instruction via the phone, for example, and you don't pay attention or you don't read back the information to the doctor, it can sound the same, and in the process you can give the wrong medicine. Okay, and that can lead to medication error. There are also medicines called high alert medicines. These are medicines basically which have a very high risk of causing harm or injury to a patient when they're used in error. We have things like insulins, you know about them. We have opioids and narcotics, they also fall in that class, and some sodium chloride formulations. So what happens? These medicines should therefore be stored under lock and key, and the key should stay with one individual assigned, and when they are not there, they should assign it to the next person, who is then the custodian of that facility, of that particular compartment. And the compartment and the individual drugs should always be labeled with a sticker written high alert medications, so that it can alert someone who is going to use them that these medicines contain a very heightened risk of injury or harm to a patient when used in error. Yes, so basically those are some of the aspects surrounding medication errors. So what is the impact, or what are the consequences of medication error? You've seen people have lost their lives. There are fatalities around it, hospitalization definitely. There are birth defects that have occurred due to medication errors. You know, some medicines are contraindicated in some ages and some populations. So when you ignore that, definitely you know the consequences. We also have litigation factors where some hospitals and individuals have been sued as a result of medication errors. That is very common. We have permanent disability and injuries to patients due to medication errors. So at what stages can a medication error occur? Number one is at the manufacturer stage. How? There are some medicines that can be manufactured, but by accident or due to the processes around it, it comes out with contaminants. We've heard of medicines being recalled by the Pharmacy and Poisons Board because of contamination, right? That's number one. Active ingredients. Maybe the active ingredient is not what is being indicated, or the strength of the active ingredient is not correct. That can occur at the manufacturer stage. So those are some of the issues, or even the leaflet. The information on the leaflet of that medicine might not be correct. It might be misleading. So those are things that can lead to medication error from the manufacturer's perspective. How about the prescribing stage? A doctor can be irrational in terms of their prescription. They can prescribe too many medicines to one patient, and that's what we call that's what we majorly call polypharmacy. At the end of the day, the patient might become confused on which one to use and which one not to use. This can lead to medication error, or they might not even comply at the end of the day. We also have seen areas where the wrong dosages are prescribed. You see, we use age, and most commonly we use weight per kg for calculating dosages. So if there's an error in calculation of dosage, definitely we can have medication errors. We have illegible handwritings. There's some doctors that just scribe something, you can't even make out what they're saying. So if interpreted the way it is, then it can lead to a medication error. Then selection of medicines to treat a particular condition. It might be ineffective choice of medicine, therefore leading to a medication error. At the dispensing stage, that is at the pharmacy, the wrong patient is given the right medicine. The frequency is not indicated. The labels are not legible. You can't read them. The dates are not indicated. The expiry days are not explained. The storage conditions are not explained, and such like events. The mixing, the reconstitution was not done well. So those are the things that can also lead to medication errors. Or basically, you don't take more information or history of a patient. There are patients with allergies, allergic reactions to medicines. Maybe they have allergy to sulfur. They also might be reacting to maybe a cephalosporin or even a penicillin. If you don't take history proper, that is from the doctor stage all the way to the pharmacy stage, then we can have medication errors resulting as a result of that. And you know the consequences of this. It can lead to the factors that we've just talked about. Also, at the transcribing stage, where you're given a prescription and then you're supposed to feed it into a system, or basically transfer it into a patient treatment sheet. If you do not understand well, kindly ask instead of going ahead and making an error. Dosages might not be correct. Number one, you have to ask the doctor. The handwriting might be legible, so you can make out which particular medicine was being prescribed here. And if you go ahead and guess, then you know this can lead to a medication error. At the follow-up monitoring stage, there can also be errors, medication errors. There's a reason why patients are always given a review date to find out how they are progressing with the treatment plan. So you as a doctor, you have the power to change the treatment plan of a patient if it is not doing well with that particular patient. Failure to do so can lead to a medication error. And in some stages, there's no need of changing the treatment plan of the patient. Also, if you go ahead and change that plan and it was not necessary, it can also lead to a medication error. So those are some of the points and dimensions under which medication errors can occur. So we go to the causes of medication errors, and this one we are going to base them according to the healthcare perspective, the healthcare worker perspective, environmental perspective, user perspective, and manufacturer perspective. Let's start with the manufacturer, which we've said it could be as a result of ineffective devices or machines being used. Also, it could be as a result of the protocols or the procedures that are being used there. Can lead to contamination, breakdown of machines, and everything else. So how about the healthcare provider? What are some of the things that make one to commit a medication error? Number one could be as a result of miscommunication between the healthcare providers within that particular department. Somebody has told you this, you've not heard well, and then you've gone ahead and prescribe or dispense that particular medicine without counter-checking. Then it can be as a result of disruptions. Maybe you are doing prescription, then a colleague pops in, and then that's how the information goes away. You go ahead making an error during the prescription or dispensing of the medicine. Can be as a result of overworking. Schedules, yeah. Schedules should always be flexible so that you don't burn out. There are also things like physical and psychological health issues. You should be of a fit mind to come to work and even to see a patient, because it's a very critical stage. If you don't feel well or psychologically you are not okay, then I think you have all the rights in the world to discuss it with somebody or your manager and get a solution before you start handling patients. It could also be lack of, or we just say inadequate knowledge and experience. Maybe you don't know anything, you are a trainee or something like that, or you just don't want to refer and get more information about that particular medicine that you are about to prescribe or dispense to that particular patient. Lack of or inadequate therapeutic information on the medications can also lead to medication errors. That's where you get allergic reactions, dosages, the right dosages, at what age, at what weight per kg. So you should have a proper therapeutic information about medicines. Then lack of perception of risk. Maybe you just prescribe medicines. You don't, there's always something that tells you that, let me ask more about this patient. Do they have other underlying conditions? Are they using other medicines as we speak? What allergic reactions do they have with medicines? Do they have other issues? So if you don't perceive that well, then it can lead to a medication error. So environmental factors, basically just the setup. Do you have proper lighting? Do you have proper ventilation? What are your shifts like? Are you being overworked? So you go into a mental breakdown or something like that. That can easily lead to a medication error. On the user perspective, that is the patient now, the consumer. It can be language barriers. Some setups, people are used to their local languages. So in this circumstance, most of the time you find challenges if you are not conversant with the local language. Another thing might be literacy levels. Maybe some of them are not learned enough to understand whatever you're speaking about medicines. Yes. Also, it might be personal issues. Somebody's preoccupied as you're explaining the medicines, or alternative, they have a fixed mind about what you're going to say. So it is very difficult to change the perspective of such an individual. Also, so basically, those are some of the major causes of medication errors. Also, you can have we have some advanced facilities where they use systems. They've gone into health information systems where all the patient data are kept in the system. So if the wrong data concerning this patient was fed from the beginning, then all the way there will be medication errors until that problem is identified and corrected. Then there are basically some systems that break down most of the time, can also lead to a medication error because you don't know now what was the prescription, what were the information, what was the history of the patient and all that. Yeah. So how can you approach? What are some of the best practicable solutions to medication errors? Number one, as a facility, you must have procedures and protocols that guide correct medication use, or that guide medication errors, a policy around that. It will guide and it will form one unison that the healthcare providers will follow so that they prevent this. Also, there should be proper, continuous knowledge assessment of all healthcare providers. So that means there must be impromptu trainings, continuous trainings on therapeutic information surrounding medicines so that you are knowledgeable. The healthcare workers are knowledgeable enough on medicines and even the patients and the information they should take before they prescribe or dispense the medicines. The users, that is the patients, should be empowered on correct use of medicines with such talks that we do every single now and then. For example, patients on inhalers, they should be demonstrated to how to correctly use inhalers and given a time to return or to show back how to correctly use those inhalers. Also, other things should be like flexible working schedules, assessing the mental well-being of the healthcare workers. There must be enough resources so that you don't do things on a shortcut. There must also be passion for knowledge. You see, you just have to refer. There must be proper documentation of all the things that you do. And also, go system. Most manual things are nowadays systemized. Even the labeling, the patient names. Just get a system which can correctly interpret the information of the patient and then transfer it. You get a printer that works well and then print out the label. Put it on the bottle of the patient so that you minimize errors. Also, there should be proper communication between the staffs. Yes. So there should be adequate communication. There should be no disruptions, no interruptions during the process of prescription and dispensing of medicines. Another thing, there should be proper handovers. Most facilities use shifts. So if a wrong information is handed over, you know that there'll be a medication error definitely. If there was error in that information that was being handed over, then definitely an medication error is always the final consequence of such situations. So basically, those are some of the few solutions or practicable solutions that surrounds correct medication use and can be used to prevent medication errors. Also, there's a very important aspect called the 5 R's of either administration or prescribing of medicines. Yeah, it must be the right patient, right dosage, right frequency, right time, right name, dates, and etc. Yes, so if you maintain the 5 R's of prescribing, dispensing, or even administration, then there are very high chances that there'll be very minimal medication errors. Okay, so also some facilities have gone into interventions where they prescribe or dispense the medicines. After 3 days, then they make a follow-up on the patient. They take their contacts details. They just find out how they're doing, if they have any challenges with the medicines, and then correct accordingly, which is very good, by the way, because at that point is where you can correct so many things. Also, kindly always remember to call back the doctor if you're not sure. And then during the process of calling back the doctor, you have to read back. There are some prescriptions that are given over the phone. Make sure that you read back the information so that you are sure that whatever you are transcribing is whatever the doctor has prescribed or communicated over the phone. So also, the pharmacy has the sole responsibility of doing medicine interventions. If you see a wrong dosage, if you see the wrong medicine being prescribed, then you have all the rights in the world to call the doctor, discuss it further, and if it is correct, then now you can go ahead and dispense it. Don't just be somebody who just clear and forward. Yeah, so basically that is my info on medication errors, and hopefully you find this very helpful and applicable in your healthcare facilities. Thank you so much, and do have a beautiful week ahead. Asante sana.